and welcome everyone. My name is Lisa Prentice, and I'm a physician assistant here at Cosmetic Enhancement Center of New England.
And I'm Leah Paskowitz, a medical assistant here at CEC. We have been providing cosmetic and aesthetic treatments for nearly 30 years and are pleased to have you join us for our medically supervised weight loss virtual event.
Stay tuned until the end of the presentation for our live Q&A session where you can submit your questions via the Questions tab, and we will be answering them live.
If you stay until the end of our event, you will be entered into a raffle for a series of 6 Emsculpt Neo treatments valued at $3,000.
Also, when you sign up for our weight management program by August 30th, you will receive a complimentary series of 6 Emsculpt Neo treatments for one area, exclusively at our Falmouth location.
Make sure to take advantage of these incredible opportunities.
Our medically supervised weight loss program is designed to provide safe and effective results, tailored to individual needs. The distinction of medically supervised means that our program is overseen by medical professionals, ensuring that every aspect of your weight loss journey is monitored for optimum health and safety. This supervision includes regular check-ins, personalized treatment plans, and ongoing support to address any concerns or adjustments needed throughout the process. By offering a medically supervised program, we aim to enhance the efficacy and safety of weight loss, allowing for a holistic approach that supports your long-term health and wellness. GLP-1 injections are utilized for weight loss due to their significant effects on appetite regulation and insulin sensitivity. GLP-1s help to enhance insulin secretion, slow down gastric emptying, and promotes a feeling of fullness, thus reducing overall food intake and aiding weight management. By targeting these key hormonal pathways, GLP-1 injections provide a medically supervised and effective method to support weight loss, ensuring optimal health and long-term wellness. These treatments offer improved satiety, decreased insulin resistance, and a reduction in visceral fat, a very inflammatory issue that is linked with a host of medical comorbidities. GLP-1 medications are innovative treatments designed to support weight loss and metabolic health. While these medications were originally developed for type 2 diabetes, they have proven highly effective in helping individuals manage their weight. By mimicking the natural hormone glucagon-like peptide, they regulate blood sugar, appetite, and digestion, leading to reduced cravings, slower digestion, and feelings of prolonged fullness. Studies indicate that GLP-1 medications can be up to 6 times more effective than diet and exercise alone in achieving sustainable weight loss, in addition to decreasing cardiovascular events, with emerging data suggesting cognitive benefits as well. The treatment process begins where we assess your individual health profile to determine whether GLP-1 therapy is a suitable option. Once prescribed, the medications are administered through a tailored approach to reach a patient's objectives. Throughout the program, ongoing wellness consultations, exercise, and B12 injections are provided to ensure optimal results and continued support. So, Karen, it's nice to meet you.
You too.
Tell me a little bit about what brings you here and what your goals are.
Well, I've just been on the yo-yo dieting plan for a while now, and I'd like to try something that I'm hearing good things about.
Yeah, I'm glad you're here. This is the first step into basically taking control of what the next section of your life is going to be.
I'm excited.
What I like to do during a consult is make sure that you're a good candidate for these medications. So we typically want to get a set of labs to make sure that your organs all look safe to proceed. I prefer fasting labs. And then once we get the labs, we sit down and we do a comprehensive visit. And that's a deep dive into you, Karen, the person, but also your family history, the things that have worked for you in the past regarding weight loss, and the things that you continue to struggle with. Once we hammer out some of those things, we talk about strategies to improve the things that need a little bit of help, but also make sure that I'm reinforcing the things that you're doing well. The part of this program that I'm in love with is the in-body body composition machine. That lets me follow you along during your weight loss and makes sure that not only are you losing weight, but that you're losing fat, but you're also preserving muscle mass, because a lot of people, when they lose weight, they can also lose too much muscle, and that's not going to be the direction we want you to be in. So once we get our labs, we do about a 90-minute visit together where I do a physical exam. I look into your family history. We talk about sleep, hydration, activity levels, and we come up with a game plan. And at the end of that visit, you will end up with your first month's worth of weight loss medications. We talk about how to utilize those, the proper storage, what to do if you're having any mild side effects and how to mitigate those. And month to month, we just keep tracking weight loss, but also seeing a change in your metabolism and seeing how things start to benefit. And I see a lot of folks that are able to decrease or even get off blood pressure medications or graduate off of using their CPAP devices. So there's a lot of really lovely things that you're going to find through this program.
Excited.
It's not a sprint. This is something that good, healthy weight loss is slow and steady. And we want to make sure that you're doing it in a healthy fashion. So I do a lot of check-ins. You have the ability to contact me if you're noticing anything that seems to be unpleasant.
Okay.
But for the most part, it's a little bit of nausea, which does go away the longer you're on the medications, and just some other GI side effects, which are really easily managed.
Okay.
So I'm excited for you. This is a really, really lovely thing that you're doing for yourself. Thank you all for joining us today. Before we close, I'd like to share some exciting information about our weight loss membership program. This membership includes a one-time enrollment fee of $300 and then a monthly fee of $150. As a member, you'll enjoy 50% off any muscle contouring treatment, including M-Sculpt Neo, M-Cella, and Cool Tone. In addition, everyone in attendance will automatically be entered into a raffle to win 6 M-Sculpt Neo treatments at our Falmouth location. The lucky winner will be notified by phone, so be sure to check your text messages after the event. If you'd like to schedule a consultation or appointment, simply reply and our team will reach out to book your spot. Do you have any questions? We'd love to hear them all. Submissions are anonymous, so don't be shy. We'll answer as many as we can.
Hello, everyone.
Hello.
Hi. So we have one more joining. There she is. Welcome, everyone. Hi, I'm Dr. Atkins from the Cosmetic Enhancement Center. I'm the medical director here, and I want to welcome everyone to our event tonight. I really appreciate you taking your time out on a nice warm night to join us. We have the questions tab here that you can answer as many you can ask as many questions as you'd like. We will try to get through every question, and they are anonymous. Remember that no one else can see the questions that you ask. I'll be the moderator and reading out the questions as we answer them, and you'll get to hear some real-world experiences with regard to the weight loss medications and the program that we do. So let me go ahead and get started by introducing Lisa. Lisa is our physician assistant who is spearheading the program and who will be your provider if you decide to join us and join the weight loss program. We also have here both Leah and Missy. Leah has been on the program as well and can relate her experiences with it and her story. And the same goes for Missy. They both work at the Cosmetic Enhancement Center and have had great success with these medications. So let's get started with the first question. Okay, let's start with what happens once you reach the goal weight? Do you intend in the program to get the patient off the medications? So that's a really good question. I'm going to let Lisa start with that one.
Yeah, that is a really great question. I generally find that there are two buckets of people when they join our program. There are people who want to come in and they need just a little head start and a jump start to get some weight off. Once they do that, they are confident that they're going to feel better about putting their sneakers on and going to the gym. And it's just positive reinforcement that tends to allow folks to make better choices throughout the day, throughout the week, and throughout the month. And it really does, it's a self-propelling story. Those folks, it's very reasonable to consider tapering them off the medication. Then I have another bucket of people who know themselves, they've struggled with their weight their entire lives. They know their appetite. They have a relationship with food that is incredibly food focused. And what these medications do, and you've probably all heard of this, is it does cut down on the food noise and the food chatter. And it redefines your relationship with food so that it becomes a lovely friend, but not something that is the driving force through the day. And those are folks that we taper down to the lowest dose that keeps their weight stable. And it really depends on knowing yourself and knowing what gets you here. And it's certainly reasonable to try to remove these medications from your life, but just being vigilant that if you notice the weight start to creep back, we're always here for you. But it's a lot easier to corral yourself when you start noticing the scale tip up a few pounds than it is when it's up 50 pounds. So it's a great question.
I think that's a really great answer. And I'd like to definitely share my story with that because I went into this saying, I just need the help getting it off. I know I can maintain this and I'll be fine off the medications. And I went off for probably about a year. And I did just that. I just saw very subtly, very slowly, the weight starting to creep back on. So I went back on to be able to maintain a good weight. I think that, as we age, our metabolism changes, and with menopause, it's very hard to maintain it when you've had that issue all your life. And I feel really good on the medication. For me, it was am I gonna go on blood pressure medication or am I going to keep this weight off? And I'm not somebody who's been sitting on my butt all my life. I exercise, and I exercise well, and do a variety of things, and it wasn't about exercise for me. It was about food and metabolism and hormones, and I needed that help to be able to maintain the weight, and so I am on a low maintenance dose and totally fine with it, because it's either that for me or blood pressure medication. My weight down brings my blood pressure down, and I don't need that. So there's a trade-off, but for me it was an important decision to be able to keep it where I wanted it.
Yeah, and blood pressure medications don't trim the weight off of you. Don't look as good.
No, I absolutely don't. So let's answer another question here. It says, hold on, we have a question here with the answer. Okay, there we go. what is expected weight loss per week? For me, I think I lost about a pound a week for about 5 months, and that's what got it off for me, and that's where I reached my goal weight. How about you ladies? What was good for you?
I think that was the same for me too. It was pretty
Yeah.
slow and steady. In the beginning, it seemed like it took a little while to kind of kickstart my metabolism, but once it did, and once my motivation took over, the more I lost, the more I wanted to lose, the better I wanted to be on the program, and it also enabled me to be able to taper down on my high blood pressure medication. Obviously, the more weight you lose, the less medication you're going to need. And just seeing the success of my friends that were doing it as well was extremely motivational. And I think my greatest weight loss was, I think, like right around 34 pounds. And I have put on a few since then, but I think I've found my comfort zone right around the 28-pound mark.
Yeah.
So
I
mine,
personally
I
like
feel
to
like-
see. Go ahead, Leah.
Sorry. I was going to say mine seemed to come off a little bit quicker in the beginning, but I also feel like that had a lot to do with the fact that I'm not a big eater. It was at night after everybody went to bed and I had time to be quiet after the kids are in bed. I would have a snack after, and then it wasn't healthy. So instead of eating like a cookie, then I wasn't hungry before I went to bed. So that was like a big thing for me.
Yeah. I think a healthy weight loss is 1 to 2 pounds a week. I think programs that allow for a faster weight loss aren't healthy. Your body doesn't have time to adjust, and at this age, your skin doesn't adjust as well either. And I saw a question earlier if these medications affect your metabolism, and I wanted to answer that because I think that's a great question. They don't directly affect your metabolism, but what semaglutides do is they mimic a naturally occurring hormone that we have. And by having this in increased amounts, it changes your insulin secretion. And that in turn changes your metabolism. What we know about insulin resistance is that the more weight you gain, the more insulin resistant you become, and the more likely you are to develop type 2 diabetes. So that's where my passion is preventing these secondary comorbidities by, yes, losing weight, but also changing the way that your body responds to food, and it becomes more efficient, and you don't get those insulin surges, which in turn cause cravings for sugar and carbohydrates. So it's just this hamster wheel that's very, very difficult, particularly around menopause, to stop. And that's how these medications affect your metabolism in an indirect way.
Great. So there's some million questions here rolling in, so I'm going to read a couple more. How are there any long-term side effects? Let's start with that one. Lisa, you want to answer that?
Yeah, great question. I think the thing that impresses me the most about these medications is the longer they're on the market and the more that people are doing them, the more benefits are coming out. At first, it started off with tightening up people's hemoglobin A1C if they were diabetic. And then, oh my gosh, people on these medications lost weight. And then anecdotally, information became very evident that they're reducing their cardiovascular risk, which then in turn comes to the information that is emerging about the cognitive benefits, because you're having less fatty deposits through the later portions of your life going in the brain, and your risk of peripheral vascular disease goes down. We have somebody in our program who tested out of needing her CPAP. There's right now no known long-term side effects. I will say that there are 3 people who should not take these medications from a safety standpoint, and I think it's important to state who those people are. It's anybody with a personal or family history of medullary thyroid cancer, which is a very specific type of thyroid cancer. Those people should not take this medication because the rats that were studied developed cancer. To date, there has not been a human being to develop thyroid cancer, but it is one of those contraindications. The second type of person who should not take this medication is anyone who has a family history of a pretty aggressive inherited cancer called multiple endocrine neoplasia type 2. It's very rare, and typically, if anybody in the family has that, you would all be talking about it and being discussed whether or not to get genetic testing. The third individual who should not take these medications is anybody who has had pancreatitis, which is inflammation of the pancreas. And once you've had it, you can't ignore it. It's a very uncomfortable experience where your pancreas gets inflamed. There is a mild risk of having pancreatitis with these medications, although there was an NIH study that came out in February of 2025 that said that there is no more increased risk on these medications than just general all comers. So, but it is something that during our consultation, we go over extensively with you.
So one person's question was, is there a BMI level that you must exceed?
That's also a great question. So, not a big fan of BMI. It is not a great measure of someone's overall health or muscle mass, but it is still a standard that's used by the medical community to determine whether you're overweight or obese. We do not discriminate, I guess, for lack of a better word, for anyone that is under a certain BMI. If you, during our consultation, if we're talking about how much weight you want to lose and you fit the criteria, we aren't married to any particular amount of weight that somebody needs to lose or a specific BMI that you have to be.
Okay, and I have a couple of questions here regarding what is the medication that we're using, and is it, someone asked, is it Wegovy and Zepbound, and which GLP-1 we're using. Basically, most of our patients are on the compounded semaglutide and or tirzepatide, which is the generic form of the Zepbound, Wegovy, and Mounjaro medications. So the way our program works, and this is another question that was in here, you pay an enrollment fee and a monthly fee, and that gives us the monitoring of your program. If you choose to get a prescription of those medications and buy a prescription, you can do that. But we recommend the compounded ones because we can be much more precise in how much we prescribe. Some of the problems, and I saw this question come up as well in here, some of the problems with semaglutide, and this happened to me, is that when you take it, sometimes the standard increase in dose is too much for people. I would never have been able to take
Commercial dosing. The
commercial medication, because when I took it, I was getting a lot of nausea in the lower dosage, and as you increase it, I would never have gotten to the next dose. I would have had to stop, and the lower dose that I was on wasn't working, so I needed an in-between dose. That in-between dose is only available if you get it compounded. And that seemed to work for me. It gave me the weight loss, but not the nausea and any other side effects. So, we prefer the compounded versions. It also allows us to add other things to it, like B12 to the injections. But you can choose to get the prescription if you prefer.
Yeah. Yeah. I think so. So semaglutide is the generic term for Wegovy and Ozempic, and tirzepatide is the generic version of Zepbound and Mounjaro. Both of those medications have the GLP-1, which is one of the hormones that our body is already familiar with. Tirzepatide has a secondary medication in it called GIP, or gastric inhibitory protein peptide, excuse me. And so that adds an additional factor that works with the brain. And I can certainly go into depth with anybody who's interested in learning the differences about that with when we do our consultation. As Dr. Atkins said, the commercially available doses, there's 5 commercially available doses. So if you qualified for your insurance to pay for this, you would start off with a certain dose, and then each month they would move you up through the ranges of already prepared doses. With the compounded versions, we can tailor this to exactly what somebody needs, which is part of the beauty of what I love doing. Is when I check in with everybody and I see them every month, they tell me how their month went. They would say, I would have a little bit of nausea about 24 hours after I injected the first syringe, and then I was fine for the rest of the month. And then we'd look at their weight loss and we discuss collaboratively together, let's bump you up this many units. By the same token, if somebody came and talked to me and said, yeah, I just didn't feel great, I wasn't even really hungry, I didn't even want to make dinner, oh, then we can dial it back down and get you to a place where that sweet spot is, like Dr. Atkins was saying, where she was given a certain dose, didn't feel great, but a mere few units lower, and she hit that sweet spot. So that's what I do love about the compounded versions of these. They're also mixed with vitamin B12 and glycine. So the glycine is to help muscle preservation, and the B12 is there to help with the GI side effects, namely nausea. But also, when you're not eating as much, you're not eating as many healthy things either. And we all need B12 to help convert the energy that's in food into the form that the cell can use. So go B12 is what I say.
Well, and also too, I think we need to kind of reiterate one of the benefits of working one-on-one with a provider dedicated to your success, because let's admit it, I mean, we've all seen the ads. There are so many places that are just selling this willy-nilly, with really no utter concern to your long-term success, the problems that you're having, potential side effects. And I was reading that one person had a question about, I wasn't monitored and I had a lot of nausea, so I stopped. And that seems to be a recurring theme that we hear from a lot of other people, that, the nausea was horrible, I'm done with it, it didn't work for me. There's a lot of different ways to compensate for that and still have amazing success. And I know that's one thing that Dr. Atkins and I suffered from in the very beginning. It would be 3:00 and, she would look at me and go, oh, well, what did you have for lunch today? And I'm like, I didn't even think about having lunch. We would have to remind each other to eat. But, those are things you can touch on with, Lisa and your provider that are working with you, to monitor your labs, to make sure that you're not losing too quickly, or, make sure you're not getting discouraged. She's your little pocket counselor or pocket cheerleader to help over the rough spots. Yeah, exactly.
I was going to say something similar, like when I started at a different facility, because we didn't offer it yet. And it was the same thing where it was just go up so many units every week, and it took me in 3 months. And doing it with Lisa, it's like Missy said, she's like your little cheerleader. She's always asking, making sure that you're feeling okay, you're not having any side effects. And I know that she makes the phone calls every day that I'm with her.
Yeah.
And on people, especially when they first start, and it really makes it more comfortable.
Yeah.
And I've had to go, like, I've increased over what I was struggling with, and then we just went up a couple units instead of like the full 5, and then I got to where I am now, and I've lost over 65 pounds.
Yeah.
Oh, that's awesome.
I'm not on my CPAP anymore, and I have another diagnosis that I don't need to take all my medication for anymore, which is really good because they were bad for my heart. So all of that and the extra energy, it's worth trying again.
Right. Right. It's important to know that one size doesn't fit all, right? Some, I'm having experiences with people who are losing effective weight at lower doses. And then just because someone's body chemistry is different, other folks need to be on some higher doses. It varies very much per individual. But that's part of the fun that I get to have, is finding that place for people so that they're feeling great, their side effects are minimized. And side effects, we're talking a little nausea, constipation, which I have mad skills in taking care of, and getting folks the effective, safe weight loss with minimal side effects. And I will say that most people, generally, those side effects go away at around 2 to 3 months if they're having any. But that's one of the beauties of the program is we start slow, which does mean that the weight loss for some people, it's a marathon. It is not a sprint. We want to do this and introduce the medication into your system so that we are minimizing side effects. But as we titrate up, then you start to see the weight come down. Have I overshot on a couple people? Yeah, I've had a couple people where I've titrated up in the recommended amount, and the next month I see them and they're like, whoa, I don't even want to eat. And okay, whoa, okay, that's not great either. And we reel it back in. And that's part of learning about each individual. But I have not had anybody call me up and say that they have been barfing their brains out and they hate me.
I have a question here to give our real life experiences about the side effects, what we had dealt with, and how long they lasted, and what they were. I can tell you personally, like Missy had alluded to, I had nausea, and it kind of was the kind of nausea that I would liken to early pregnancy, where you're like, you just look at something that is fatty and you're like, oh, I can't even stare at that, and you feel nauseous looking at it. Or if you just ate a little too much with dinner, then you felt a little nauseous. Or if you didn't eat enough, then you felt a little nauseous. So
Or not frequently enough.
or not frequently enough. Like there are times when I we didn't get a break and we didn't eat anything, and we were not getting as enough food in the day even, and that was harder with the nausea, but definitely like Lisa said, dialing it back a little bit helped. Also, just being on it consistently helps for me. And then once I got put too far up, I did have one episode of vomiting. But as soon as I inched back down a notch or two, then it came right away, and I didn't even have any nausea at that point. So it's definitely a learning experience for each person. I think not everybody even gets anything. I think Lisa said you didn't have any nausea, right? Yeah.
I had a little bit, but then if you realize, like you said, you hadn't eaten enough, so you just like have a cracker, nothing too fatty or anything, and takes great care of it. Also will help blood sugar too.
Yeah.
Yeah, that was one of the, I was kind of surprised when I did my starting blood work and saw that I was pre-diabetic. That was a kick in the gut. My cholesterol was kind of high, and they were talking about putting me on cholesterol meds. And then this program became available. And I have to say, it was extremely motivational seeing my lab work down the road after I had been on it for a few months, to see my A1C drop well within normal limits, to see my cholesterol drop within normal limits. That's huge. And again, another reason why having that one-on-one support is so great, because there are so many programs out there that are like, here's your med, good luck.
Right.
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 One of the questions is, how much do you need to lose to be eligible for this program? I'm only pre-diabetic. Would I still qualify? So, with our program, it's not about, having, comorbidities, and you're not gonna need that. That's more for the people who are trying to get their insurance to cover the commercially available medications. With us, if you need to lose some weight and you are struggling to do that, we're not going to take somebody who's underweight, obviously, and help them lose weight. But if it can help you, and you don't need to have a certain diagnosis in order to qualify.
Yeah, there's no, I did see a question. We do follow BMI. One of the modalities that we're following you with is a body composition scanner. So it spits out your BMI, it spits out your percent body fat. It spits out, more importantly, your visceral fat, which is, I think, the part that we're the most passionate about. Visceral fat is all over the media right now. We know that it is harmful above a certain amount. It's the fat that surrounds your organs inside your abdominal cavity. And after a certain amount, it is super, super inflammatory, and it does a lot of bad signaling. And you're gonna hear a lot more about hormone signaling and protein signaling in the near future. But I've had the pleasure of seeing people not only get to their goal weight and tell me that they feel like themselves again, they're fitting into their clothes, but I'm seeing that visceral fat come down to a healthy and normal level, which in turn, your insulin resistance is gone. Your risk of type 2 diabetes is crashed. It is just this lovely cycle of health begets health. And when people start throwing their sneakers on and they start making better choices, and they actually come in and see me and say, I ate something that I normally used to eat and I didn't feel great. Well, that's how we're supposed to feel when we eat something in a huge quantity that's not good for us. We're not supposed to feel great. And for me, I definitely chose to ignore those feelings and eat it anyway. And this medication it somehow makes you not interested in doing things that aren't healthy.
Yeah, I know we've all said 100 times, it just kind of removes that background food chatter in your brain that's constantly there.
Yeah.
Right. I do see a great question about blood work. Someone is scheduled to get blood work in the near future. You certainly can bring your own blood work, but we do have certain things that we want included as a panel. We call it our weight loss panel. So if you want to do that, just let us know, and we can tell you what tests that we require. They're not the typical panel that a primary care practice would order necessarily. So it's fine to get things done on the outside, but also we do labs, and it's part of the $300 enrollment fee. And it gets us everything that I'm looking for to make sure that it's safe to proceed.
There's a question here about, did you personally plateau at some point? I can tell you I didn't really through it. I kept losing until I hit my goal weight. And like I said earlier, I did backtrack a little bit after going off it, and then I went back on for a maintenance dose and then hit my goal weight again. So have any of you had any problems with plateaus? And Lisa, do you see people who plateau at a certain weight and have trouble getting beyond that?
I've had only one patient so far. So the disclaimer about GLP-1 medications is that there are 8 to 10% of people who are considered non-responders. If semaglutide doesn't seem to be effective, then we can switch to tirzepatide because it does have the two compounds. Tirzepatide has a reputation for being a little bit better tolerated in terms of GI side effects and providing a little bit more weight loss. But I've only had one person that was a true non-responder after working with this person for many, many months. So she's being tapered off, and there's other things out there that can be utilized, and I can talk about that with people if they get to that point. I haven't seen anybody really plateau. I see people get to their goal weight and then start to dial the dose down so we can find out what the lowest dose is that keeps their weight effectively at their goal. And again, this doesn't mitigate, this doesn't absolve anybody from doing the other things that we need to do, such as drinking water, sleeping well, eating well, and exercising. This gives you a leg up. But if you want to get off those medications, you really need to do those other pillars that constitute good health and a good longevity of good health. Those are just as important. We're all on these phones at night. Put them down, get a good night's sleep, drink your water, move your body. When you do all of that and you get to your goal weight, it's amazing how well activity actually works at keeping you at your goal weight. There's less of you for the exercise to work on.
There's several questions in here about the cost of the medication and the monthly fee. So the way we have created the program is such that there is the monthly fee that includes the visits and the blood work and the in-body, as well as a discount on some other procedures like Emsculpt, and we'll get into that again after this. But the medication itself is paid for separately, and you can get it either through us compounded, and you can either get the semaglutide or the tirzepatide, or we can write you a prescription for the medication, and you can get it commercially. But typically, that's not going to get covered by insurance, and that is typically not as cost effective, but as doing it compounded. And we can't be as good at adjusting dosages when we're giving a prescription for the commercially commercially available medications. And so the cost of the medication depends on the person. Like Lisa said earlier, I'm on a really tiny little dose compared to some people who require much more. And it just depends on a person's body. Some people require more to even start losing weight, whereas I wouldn't have been able to get beyond the first couple of dosage adjustments in the commercially available drugs. So, that's why we make it flexible. We price based on how much you're getting, and it's by the milligram, I think, or the units that we're prescribing. And the best way to find out is get yourself a free consult with Lisa, and we can schedule these after this, so that you can figure out what excuse me, my cat's in here. What is going to be your individual cost in the beginning, and then what it will escalate to as time goes on. There I want to lead into, because we have a question now about M-Sculpt, and that is our special for the event. M-Sculpt is our muscle contouring device that builds muscle, and it also helps to lose fat, especially visceral fat, and that's really a really good pairing with the weight loss program. That's why we made that as part of our raffle and part of our program. You know, as Lisa can describe to you, the you know, the studies all over any weight loss, not just GLP-1s, show that you can lose muscle mass as you lose weight, and we've seen it. You know, where people talk about Ozempic face or you know, the issues with loss in volume in the muscle, and we can use this device, the M-Sculpt, to help to build muscle. Along with that, you get possibly even Cella treatments, which help build muscle in the pelvic floor. So there's definitely some nice add-on or adjuncts that you get discounts on those devices when you're part of the program. I think it's a 50% discount, correct?
Correct. And the number of sessions, the special that we have when you join this program, it's 6 sessions, which is typically 1 per week. There are some folks that we would recommend 8 for. That would be part of a program regardless of whether or not you joined a weight loss program with us. If you came in and you were interested in M-Sculpt, we would, you know, do a consult. We would suggest 6 to 8 sessions, and then usually a maintenance session about every 3 months. It's a wonderful modality for maintaining muscle mass and getting rid of a little bit of fat, but also some tissue tightening in the areas that are being treated.
Right. Yeah. It's a
30-minute session.
Yeah, 30-minute session. And it's not, people say to me sometimes, you know, well, I go to the gym, so I don't need that. Well, this is not the gym. This is, you know, the abdominal treatment. It's like doing 20,000 sit-ups in a half an hour. You can't do that. You can't do that in a week, you know. So it's much more intensive. And if you want to try a demo, if you're not sure about it, you can come in and do a couple-minute demo to see what it's like. But there's no way you can get that kind of contraction in the muscle. That's why it builds muscle mass.
Right.
And it goes deep into the muscle too. It's not just like the superficial muscle. Like it's down deep where you can't work out enough to get that.
Right. It activates about 90% of the muscle fiber itself. When you go to the gym, you're actually activating about 30% of the muscle fiber.
Mm-hmm.
So when you get done, it's strange. When you get done, you're sweating.
Yeah.
But you were laying there, but you're not terribly sore the next day either, because it does build in this tapping function that helps to eliminate the lactic acid that builds up within the tissue. So you don't feel like you've done a hell of a workout, but when you're done, you're sweating, which is fun. And it's involuntary contractions, so that, you know, you're getting the benefit of exercise while you're laying there. I mean, how good is that?
Right. And it can be used on the abdomen, the flanks, the glutes, hamstrings, quads, biceps, triceps, calves, you know, basically all the major muscle groups in order to build muscle mass.
Yeah. I do see a question which I have a lot, and I just want to address this, and I may be interrupting the M-Sculpt, but somebody mentioned that they had taken semaglutide in the past and had terrible nausea, and so they stopped. I encounter people like this every week who did an online program or went to a clinic and they were not monitored. Some cases, people were given vials and told, just increase it, you know, just do it the way you think you should do it. This is absolutely the opposite of what I want to achieve here. I took care of a woman who has been on semaglutide for a year. She's lost 30 pounds and has been throwing up every day for a year.
Oh.
And the first thing I asked her was, are you taking anything for constipation? She looked at me and said, no. So we got her on the program. We started her on some just magnesium, just simple magnesium over the counter. She came back to see me and she said she had not been sick once that month. It was an absolute game changer for her. I started her back on a little bit of a lower dose, and she is happy as a clam. She has not felt this well in a year, and she's just delighted. So you may have had nausea with another program, but I'd be really curious to know how that program was run, because I'm pretty sure I can get you through around with our program and not feel like you have to stop.
Somebody's asking, is it weekly office visits?
No. Right now, the way that we run the program is getting a set of labs. Once we get the labs back, which take about 4 or 5 days, we do a comprehensive visit, and that's where I do a deep dive into you and your family history and your health habits. And after that, it's once a month you come in, we sit down, we check your weight, we talk about what's good, we talk about what's bad, and then you leave with your next month's medication. That's a weekly injection, subcutaneous, usually in the abdomen, and tiny, tiny little needles. You know, the first time that people do this with me in the office and I see them inject themselves and they look at me and their eyes are big, they're like, oh, that was so easy.
That's
So
it.
it's yeah, that's it. So it's very, very easy.
Very doable, very affordable. And
Yeah.
skinny does feel good.
Yeah.
Go ahead. Were you going to say something?
No, just you know, so many women come to me and they point to their middle and they say, I don't know, I work out like crazy, I eat the right things, I count my macros, I know the calories of every food, and I can't lose a pound. And I'm like, yeah, I know. I totally get it. 40s, 50s, 60s, and then the ends. And it is frustrating. But when they finally start to get to that 15, 20-pound weight loss and they come in and they're smiling, they're saying, I feel like I'm in my own skin again. I feel like myself. That is heaven to me, because I totally understand. I totally understand what
We've
they're
all been
saying.
there.
Yeah. Yeah.
We have a question. I have bicuspid aortic valve with mild stenosis. Would that be an issue for trying this?
No. Nope.
It's not an issue at all. Can your blood sugar dip too low occasionally?
Not unless you have problems with hypoglycemia to start with. This does not drop your blood sugar like some diabetes medications. You cannot be on any diabetes medications, whether they're oral or not, because the combination of any of the oral diabetes medications plus this can drop your blood sugar, but no one has dropped their blood sugar.
Somebody mentioned, I thought compounds were disallowed or pulled off the shelves or something. I remember hearing something like that on the news. So that has been in the news, but it's not that they were pulled off the shelves. What happened was that the commercially available drugs companies were giving the compounding pharmacies a hard time for producing the medications that were exactly like the medications that they were producing. I think at this point, there are certain pharmacies that are still allowed to dispense it. There are some that aren't the right types of pharmacies that can't dispense it. We are still able to get compounded medications right now.
Right. Yeah, the FDA basically allowed compounding of these medications back in the 2000s because the two drug companies that make them could not meet demand. So that's what compounding pharmacies do. When they can't make enough, they step in and they sort of save the community by being allowed to compound these. In the beginning part of this year, the FDA said, "Oh, from what the companies tell us, they're able to make enough so that everybody can have it." And it is not, that's not the case. So the compounding pharmacies that are still able to manufacture and dispense this, they're steadfast. They are saying, we're going to continue to make this. We have the license to do so. And by the way, we're not making the same thing that you guys are making. We actually mix ours with a little bit of B12 and glycine, so it's not an exact duplicate. Semaglutides have been around a little bit longer. There are a lot of legal loopholes regarding that medication. They're going to allow that to continue to be manufactured. Tirzepatides, right now there's a little bit of question over tirzepatides as to whether or not the FDA, and there's a lawsuit between the pharmaceutical company and the compounding pharmacies. So not sure about tirzepatides. The Eli Lilly was a little smarter when they launched this on the market and they closed some of those loopholes. But semaglutides are here to stay. Hopefully tirzepatides will be, but eventually that patent will run out too.
All right. So, sorry about that.
Hi, Cookie.
Yes, that's my cue. Actually, I was going to bring this to a close and tell everyone thank you for coming. We really appreciate it, and to make sure that as a reminder, you will be receiving a text message. Please hit reply with the code word GOALS. GOALS, GOALS, to be contacted for a consultation. So don't forget, you'll get that text right after this and reply with the code word GOALS. Again, thank you so much for coming. I really appreciate it. We do have all of your questions logged, and if we did not answer your question, we will do our best to get back to you to do that. But please schedule a consultation, and we will let the winning raffle person know as soon as we have drawn that raffle and find out who is, and we'll probably announce it on social media, so watch for that too. I guess that's it. Thank you again.
Thank you, everybody. So glad you joined us. See you soon.
Okay, bye-bye.